Friends, this is our second episode on diabetic retinopathy. In case you have missed our first episode, please find the link on your screen right now. Please do watch it to understand how diabetes affects our retina and much more. In today's episode, we will discuss how to assess the extent of diabetic retinopathy, what are the various tests and gadgets that help us to gauge the damage caused to the retina due to diabetes. So let's begin. Hello friends, I am Dr.Bhavin Shah. I am a vitreoretina consultant and surgeon at Dr. Eye Institute, Mumbai. Welcome to our channel Eyelogues, which has everything to do with vision and eye care. I am sure you have already subscribed to our channel. If not, please do so, and also remember to click the bell icon so that you get a notification each time we post a new video on our channel. How do we assess the extent of damage caused to the retina due to diabetes? Though a lot of sophisticated and state-of-the-art machines are available today to measure or quantify the extent of damage caused to the retina due to diabetes, none can substitute a meticulous clinical examination of the retina by a retina specialist. Friends, as you may recall from my introductory video on the structure and function of the retina, the human eye is analogous to a camera in many ways. Just like the aperture in the camera, the pupil or the central black dot in our eyes controls the amount of light that enters our eyes and also the amount of retina that is visible to an eye doctor. In its natural state, the pupil is only about 3 millimeters in size, and therefore it allows only a small central portion of the retina to be examined and checked by the eye doctor. However, when the pupil is dilated with the help of special eye drops, its size increases to about 8 millimeters, and this allows the retina specialist to assess a much wider area, in fact the whole retina, to look for any changes caused due to diabetes. Therefore, a dilated retina checkup is paramount for screening and early detection of diabetic retinopathy. These changes in early stages of diabetic retinopathy include retinal hemorrhages or red dots on the surface of the retina, retinal cholesterol deposits or yellow dots on the retina, and cotton wool spots or white patches on the surface of the retina. And these changes may be present in the retina even before the patient experiences any visual symptoms. While retinal diagrams may help to record these changes, color stereoscopic photographs of the retina are the best way to document and compare the changes of diabetic retinopathy over time, and they also help to assess the response to various treatments. With the pupils dilated, a special machine called the fundus camera helps to capture crisp photographs of wide areas of the retina as desired. The procedure is non-contact, non-invasive, and requires the patient to place his chin on a chin rest while the examiner captures the necessary photographs in color and red-free modes. The entire process takes only a couple of minutes, and the photos so captured can be easily printed on a photo paper for permanent record. The OCT or the Optical Coherence Tomography is a test which has revolutionized the diagnosis and management of diabetic retinopathy. It is the best test for early detection of any swelling in the central part of the retina caused by diabetes. As you may recall from our previous video, diabetes causes the normal blood vessels of the retina to become leaky, causing leakage of fluid and cholesterol, and thereby swelling in the central part of the retina. This causes blurring of central vision and sometimes even distortion of objects. The OCT is a rapid, non-invasive, non-contact, highly precise and accurate test that gives us a cross-sectional image of the central retina. It is similar to a CT scan but without any exposure to radiation. It provides high-definition images of the central retina with a resolution of about 10 microns, which is about 1/100th of a millimeter. The machine performs nearly 70,000 scans in a second and can complete the image of the central retina in less than 2 seconds. Moreover, it also helps to monitor the response to treatment. As you can see, the upper image is that of a normal retina, which is only about 250 microns in thickness, and the OCT enables us to visualize all the 10 layers of the retina distinctly. The lower image is that of a patient having swelling in the central retina due to diabetes. The large black oval-shaped spaces represent areas of waterlogging in the retina, while the bright white dots represent the cholesterol which has leaked from the blood vessels due to diabetic retinopathy. In this set of images, the upper image is the OCT scan prior to treatment, whereas the lower image is the OCT scan from the same eye of the same patient taken 2 weeks after treatment for swelling in the central retina. As you can clearly see that after treatment there is a considerable decrease in the swelling of the central retina along with improvement in the patient's vision. Thus, the OCT is an indispensable tool for detection as well as monitoring treatment response in diabetic retinopathy. Friends, as you may recall from our previous video, diabetes causes closure of tiny blood vessels in the human retina, thereby decreasing the blood supply and oxygen supply to the retinal cells. The human retina responds by formation of new blood vessels on the surface of the retina through the secretion of chemicals called growth factors. Fluorescein angiography is a highly sensitive test for early detection of these new blood vessels. It is an invasive test. It involves the injection of a dye called sodium fluorescein in the veins of the hand. The patient places his chin on the chin rest of the machine, while the examiner takes serial photographs of the retina using specialized filters. The test typically requires only 5 to 10 minutes. The new blood vessels being leaky leak the fluorescein dye, allowing their easy identification. Similarly, fluorescein angiography also helps to detect the location of the leakage points in the normal blood vessels of the central retina, resulting in a swelling of the central retina. Sealing these leakage points with the help of retinal laser treatment helps to reduce the swelling in the central retina. Finally, fluorescein angiography also allows for the detection of closure of tiny blood vessels in the central part of the retina, which may also contribute to vision loss in diabetic retinopathy. Thus, in a nutshell, fluorescein angiography helps us to better visualize the vascular changes caused due to diabetic retinopathy. Friends, in advanced diabetic retinopathy, blood may sometimes leak from the new blood vessels into the vitreous gel of the eye, causing a severe bleeding or hemorrhage inside the eye. This not only obscures the patient's vision but also prevents examination of the retina by the eye doctor or scanning of the retina by the OCT or the fluorescein angiography. In such cases, a B scan or a sonography of the eye helps to assess not only the extent of hemorrhage or bleeding inside the vitreous gel but also the status of the retina behind. The B scan is a non-invasive test and requires only a couple of minutes. Thus, friends, to summarize, a dilated clinical retina checkup, stereoscopic color photographs of the retina, OCT scanning of the macula or the central retina, fundus fluorescein angiography, and a dynamic B scan or sonography of the eye are the main tests in a case of diabetic retinopathy. These jointly complement each other and provide us a complete and meticulous assessment of diabetic retinopathy in our eyes. Friends, this brings us to the end of today's episode, the second episode in this small video series on diabetic retinopathy. Stay tuned to our channel for more such informative videos, and please don't forget to spread the word amongst family and friends. Take care and stay safe.